welcome to episode 6 of the Limelight podcast. Today we are going to be talking about the facts versus myths of some coronavirus topics. We're going to talk about hydroxychloroquine and why it's actually pretty awesome and working really well. And we're going to talk about just some other things. The numbers have been changing a little bit, and there's been a lot of misinformation flying around, so we're going to clarify some things. And then we're also going to answer some questions about Lyme and SOT at the end. So hang on for that. As always, we've got our awesome Dr. Sloan with us today. Hello.
Hi.
I'm Maddie. So yeah, we've just been, Dr. Sloan and I have been talking for a little while about this stuff, and we just kind of want to share the conversation that we've been having so far with you guys. And our big topic today of conversation is hydroxychloroquine, and just learning as we learn more about COVID, we're learning more about why this drug is working so well. So Dr. Sloan, can you tell us some more about that?
Yes, hydroxychloroquine has been around for a long time. Since Vietnam and even before that. It's been used for malaria for a long, long time. It's approved for malaria. And the reason it's approved for malaria is that, and this does cross over into Lyme conversation. And the reason it's approved for malaria is because these parasites hold in iron and they build off the iron. And that's the molecule that makes them survive. So hydroxychloroquine still robs the iron out of the parasite. So the parasite just can't live anymore. So it also works for this virus. The way it works is two things really. The first thing that it does is it creates an acidity around the cell. So the acidity around the cell used with the zinc, it helps to make the virus not get into the cell. So viruses are only genetics. They're just short replication sequences. They have to go into our cell, combined with our DNA to make its replication sequences, or it's called shedding. And hydroxychloroquine makes it harder for the virus to enter the cell. Even on a bigger note, the reason that a malaria drug, which is an antiparasitic drug, works for this virus is the fact that it has nothing to do with killing the virus. But this virus creates a iron buildup in between the capillary bed and the arterial bed in the lungs. And so doing that, it stills the place where oxygen would be, and it creates an oxygen deficiency. So hydroxychloroquine will take that iron away. And then the virus just goes through a normal sequence of, 36 hours, 48 hours. It's patients that are treated are being released from the hospital in 12 hours to 36 hours, and they're not going on ventilators. It's been really interesting. So no, it's not double-blind placebo-controlled study for this, but we know exactly how it works, and it's safe and effective and cheap. So that's it in a nutshell. And there's some other things we can talk about it, but yeah, it's a good drug. We have it here at the office, and we can prescribe it now for patients with just exposure. You don't have to be COVID positive to have the medication on hand if you get sick.
So that's, when I first started hearing about this drug, there was a lot of fear mongering about, oh my gosh, the drug is so bad. And then there was like that guy that drank the fish tank cleaner, which is just stupid. RIP. But, in reading about this, this drug has been used for so long. It's on the list of the WHO's list of important drugs for countries to stockpile because it is used so much in so many countries that, countries that are developing their own healthcare systems in like third world countries in Africa. These are the drugs that the WHO tells them that they need to stockpile. So it's been used extremely widely, not as much in this country as in many, many other countries all over the world. It's very cheap to make, and it's something that's very easy to make. We don't rely on other countries to make it for us, which is important in this time. And in reading about the side effects, the horrible side effects that are apparently supposed to happen, there's really not that many cases of anybody having a horrible reaction. There's sometimes people will have like slight side effects if they're getting too much of it, but then you just like taper off and then they end up being fine.
Yeah. There are some cardiac side effects, but it's going to be for patients that have malaria and they're on the drug really high dose for long periods of time, or
Right.
it's for patients that have lupus or rheumatoid arthritis and they've been on the drug for a long time and they probably have some underlying conditions to begin with, but we're not getting any side effects at all for using it for 5 days.
Right. And I think where, there's a lot of misinformation is people don't necessarily understand how drug prescribing works. And so when all of these drugs, because this virus is a novel virus, we've never seen it before, there have been no tests on drugs that work on this virus. So there's no, FDA approved treatment for this virus because we've never seen it before. And generally with, getting medications approved, you're not allowed, even you as a doctor are not allowed to prescribe things off label. So you have to prescribe medications for what they're supposed to be used for, even if the chemistry works to treat something else. You're not supposed to do that. So I think people have been confused as to why, there's been, a lot of talk about this drug, and it's not because the drug doesn't work or that it's not safe. It's that it hasn't been used for this specific virus before. So that's why they're talking about, oh, well, there's only anecdotal testing and it's not peer reviewed and blah, 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 blah. It's working. Yeah. There hasn't been massive tests done on this virus because we've only known about this virus for a few months.
So, I mean, there's a doctor in New York who's doing, I think he's up to about 1,000 patients now. He's had 1 death and 2 hospitalizations out of 1,000 people. So he's going to say it's 99% effective. So there are many drugs on the market that had way less than 1,000 people studied on them. And I'm going to tell you, like 80% of drugs are studied for a certain purpose, FDA approved for a purpose, and they're used for other things. Like we use beta blockers, which are gentle blood pressure medicines for anxiety and things like that. So we can prescribe them for off-label use, but as the patients I've talked to in the past week, I've really been able to ease their fear when I say that we can prescribe a drug. It's very available now. It's cheap. Either insurance pays or it may be $60, it's nothing. And we can make sure you don't get sick and go to the hospital. So the best thing to do is stay away from the hospital because, they're causing more problems than they're curing.
Right. And I think I want to keep talking about this, but I want to clarify the pathology a little bit before we dive into this a little bit more. There's a lot to talk about today. So something that you shared with me and that we've been talking about is there have been a couple of doctors that have come out and they've started talking about how this virus actually affects us differently than we initially thought. And it is not necessarily a pneumonia that's causing people to die. It's actually the fact that this virus, as it's acting in your body and replicating and producing more virus, it is causing iron to become free of the red blood cells, which is causing damage, what you just already mentioned. And then because of that, you're not able to uptake enough oxygen. So it's basically messing up the way that your red blood cells are supposed to work. So you're not getting oxygen and you're getting damage and oxidation from the free iron that is now in your body. And that changes the way a little bit that we need to treat this. Because, we've got, everyone's talking about ventilators, freaking out about the ventilators, and ventilators are typically used for something called what does ARDS stand for?
For disease syndrome. So they're mostly used for pneumonia.
Yeah.
So in pneumonia, you have a thick mucus coating that's coating the inside of the lungs, and it's building up in there, and it's taking the space of the air. So you have to go on a ventilator sometimes because you've got to force the lungs to open so they get enough oxygen. With this disease, it's not a pneumonia disease like they thought originally.
Right.
is a hypoxia. It's a low oxygen disease. So in fact, it's it's been done, and it's easy to say this now, but even a CPAP machine, which just puts oxygen in your lungs with a little bit of pressure, works just fine. Or some patients just need oxygen, and it would be much easier. But I think they've realized this in New York, that they're causing lung damage, putting so much pressure on lung beds that don't have mucus to push through. And um, I don't know how many deaths, but quite a few of the deaths. Uh, if you go on a ventilator, you have a hard time getting off. It may not be because of the disease, but it may be because you've caused lung damage from the ventilator, applying too much pressure into the little tiny sacs that are air filled, and they're kind of vulnerable.
Right. And I've seen, like that one video of the doctor was saying that it's still important to have the ventilators because you still need for the patients that are really, really bad off. But the way you would use it would be different, and you would do much lower pressure with higher levels of oxygen because you're not trying to push through, like you said, you're not trying to push through that layer of mucus.
Yeah. But the problem is that the the standard of care, the SOD, hasn't changed as fast as we've changed with this virus. So I mean, I'll tell you, and I think, for yourself, I was fairly nervous about this when it came out. The numbers were overwhelming. I didn't know what to think. It was best to stay safe than to not stay safe before things came out and we knew more about it. And now, I mean, I feel so comfortable with it, and we are going to have a lot of deaths, but it's probably going to be even less deaths in a bad flu year.
Yeah. Well, that, to me, that was the part of this that was making me feel uncomfortable, was that no one could explain, and I wasn't seeing any studies or any research or any doctors talking about how it was actually killing people and what it was doing that was really the problem. And, you had people saying, oh, well, it's damaging the lungs, or it's causing the cytokine storm. And to me, that still wasn't enough of an answer, because that, if you're dying of cytokine storm and you're getting sepsis, why is that happening? Why is the virus causing that to happen? And so now we understand, it's liberating the iron. The iron is causing damage, and lack of oxygen. So that makes a lot more sense. And because we understand that, we can treat it.
Yeah, one of the benefits of understanding this virus is knowing how viruses create oxidative damage in the cells, and they all do. Everything that's in us, in the fight through us, and our immune system is reacting to the bug. The bug is not controlling us. In fact, I'm going to say this: viruses don't kill us. It's the side effect from having the virus, like a secondary infection. Like, all viruses create mucosa buildup on the linings, and then there's patients that are weak are going to have problems with mucus buildup and pneumonia and sepsis. So one of the benefits we recognize now, and even my ER physician that I work with here will say, that vitamin C is now on the world map. It's going to become conventional for a lot of treatments. So it's getting its recognition finally.
Finally.
So vitamin C will fix the oxidative damage, so you recover faster. It also controls sepsis. So if a patient is having some infections that's going around the body, it'll control that. Of course, it chelates the iron from the lung, and the zinc along with that. The zinc in this setting with the chloroquine helps the chloroquine work better. It creates a different permeability in the cell. But we all know that zinc has always been an antiviral agent. Every day we need to be taking our ACEs, ACE, zinc, and selenium. These are our main guys here. And then over here is glutathione, which should be kind of like over here. It's really important to take these, and it's really important to take them every day, not just now that you may think you're getting a virus, but we age and we have oxidative damage from the food we eat and the air we breathe. But yeah, the virus is, gosh, this has really been nice to see patients, doctors talking about our immune system and how viruses have been with us for the millennia, and that we know that we can fight them. It's just those that have underlying conditions are going to need more support support, if we give them the correct support, if they started giving hydroxychloroquine to every COVID positive patient right now, think I don't think that we would have any more deaths or very low deaths.
That would be awesome. I do think that, we've so far seen overwhelmingly positive. I've yet to see any studies where it hasn't been working. There are some people they've given it to where they've been too far gone. They've been on the ventilator for a long time already, where they still maybe don't make it. But I think if we're able to change the standard of care, it's standards of care are developed over long periods of time with many, and this is all moving so fast. It's all happening so fast that people are just really doing their best with very little information. So now as we're getting more information, I think it would make sense to switch the standard of care to immediately prescribing hydroxychloroquine or prescribing it preventatively. And then, hopefully we would see way fewer people ending up needing to be on ventilators. And then also just understanding that these people need way more oxygen. It's about oxygen. It's not about their lung muscles not being able to pump oxygen or air, whatever.
Yeah, this is what we have used for Babesia in the past. Since it's a blood parasite, it does the same thing. It builds up iron and it uses it to live off of, and it's a defensive mechanism. So patients have been prescribed it, and we prescribed it for Babesia every now and then, but there were other better alternatives for Babesia, but it's still the same principle. Parasites build iron. We can take it away, we can stop the damage, and patients don't have to go on ventilators, and then everybody's happy. The deaths now, I think Fauci has said that we may be closer to 60,000 deaths instead of, I don't know, 120, 200,000, a million. I mean, there's been so many scare tactics that have been out there to keep us harvested in our home and quarantined in our home, when we're not helping anything by flattening the curve, because you make the curve longer and you cause it to be around longer, and we can't create the antibodies to help others not get sick. So
Speaking
this has
of
been a real learning.
What do you think about herd immunity?
Yeah, every virus that we have ever been exposed to is one that needs to start developing a herd immunity. The worst thing that we did, and this may sound very contradictory, is take the kids out of school, because the kids are young and healthy. If a population of children got sick, they would spread those natural antibodies to other children. Those children would be immune. They would bring it back to the home. We would be immune. They'd go to the grandparents. Grandparents would get immune. And by quarantining everybody, we're not creating any natural immunity like we're supposed to through all the millennia of this virus. I think this is easy to see, and I think it's Sweden, where they didn't quarantine anybody and they have very low deaths, very low illness. Because they didn't close. Yeah.
Well, it seemed like, it seemed that in some places they were going to try, like the UK, they were going to try to do that for a while. And then all of a sudden it was like, oh God. And I think part of that is because we didn't have an understanding of the virus. So if you don't have a way to treat it, you can't really just say like, oh, well, let it just go through the population. But if this is going to work, and so far it's looking like it's going to be fantastic, then, if you get sick, you have a therapeutic. You can take this drug and you're just going to have a cold.
Absolutely. We can get back out of the house. We can start getting our economy moving again. And we're going to be putting out a lot of fires for big pharma. And I've been proud of a lot of Americans for doing their own research and looking at good information online, so that we can be educated and not just depend on the government for everything that we need to do and go through, because we do need to have our own way of finding information without somebody on TV telling us how it needs to be, because we all know that how the media is controlled by hype and speculation, and death sells news, life does not sell news. So now that we have this thing dying off. You can already see even the news I get on my phone, it's starting to shift into other things, other information. And now they don't have this to worry so much about. Now they're shifting to the next fear tactic is it may come back in the fall. Oh my gosh, let's start another set of emotions with it. But we need to get warm weather. We need to go outside. We need to enjoy each other. And this thing is going to die down very quickly. I don't think it's going to make any lasting approach on us other than the fact that they were able to shut down our economy. And that's a pretty big deal.
Yeah. I did read, I read an article this morning that was talking about in 1918 with the Spanish flu, with their really, really sick patients, what they started doing was doing open air therapy where they would take them outside, and they had just like incredible results with people who they didn't think were going to make it. And they started treating them. Literally, there's like pictures of just rows of beds in field hospitals outside. And these patients started recovering by just being in the sun and breathing in, you know, open air, because the sun doesn't kill viruses. The sun is great.
Yeah, heat damages viruses, and you get your vitamin D when you go outside. Yeah, that's great. I mean, this has been a big learning curve. I hope that we are all wiser. However, when I've been talking to patients this week that I would consider fairly intelligent, there's still not much that the average person knows about the drugs that work and some of the alternative therapies to stay protected. So we need to get the word out there as much as possible for this. It's just not about this virus, but it's about maintaining a healthy lifestyle and taking the right things for keeping us healthy and making sure if we do get sick, an illness, when a virus comes into your body, if your immune system does not respond to it, then it's going to damage you.
Right.
Because fever is our body protecting us and responding to the bug because it creates a higher temperature. Here we're talking about heat again, and we increase our natural killer cells and our T cells, and we can defend ourselves. So we can defend ourselves very well to viruses unless they're novel and we don't know exactly how they work. But gosh, it didn't take America too long to figure this out, and other countries knew it before us. So yeah. I think we'll know next time, you know.
Well, I think this is a really good, like I said earlier, it's a good practice because it's not detrimental. We seem to have pretty good control over it now at this point, and it's really shown us where the holes are in protecting ourselves and protecting our country. And I think too, I've been thinking about it in terms of me as an individual and what I need to do to take care of myself, to make sure I have all the things that I need. Because, you know, we do live on this earth with lots of different bugs and all kinds of things. And, you know, as history will always repeat itself. We've gone through this many times. And, you know, you have to be knowledgeable for yourself. You have to be able to do your own research. You have to be able to weed through all the BS and the media and all these myths and memes and all that. And you just have to be able to see the truth, protect yourself, take care of your family, you know, and this has been a good learning experience to kind of work that out.
I have to give you compliments because you saw this like 6 weeks before we even started talking about it in the media. You knew about everything about it. Like you already know the whole internet and in the world.
Well, what was so funny, and I think I told you this, but I'll share with the class. When I was reading this book about Lyme disease, I was reading Bitten, and there was a part there's a quote from a scientist that has like this list of things of what are signs of a laboratory epidemic, like something that has been created in a lab that is not a natural virus. And there's this list. And I was reading that chapter of the book when I started seeing the information come out of China. And I was in like beginning of January. I was like, this virus, this outbreak in China checks all of these boxes of all of these things that show that it's a lab created virus. You know, so that was initially why I was kind of like, well, this is something that we need to pay attention to because it's not behaving the way a normal virus does. And, you know, a lot of us that have been through the Lyme disease experience, we know can't really trust the CDC. They, you know.
Yeah, this is it's interesting because I can say to patients, this is a novel virus, meaning that it's new, that our body has never seen it before. That's the same thing with Borrelia. And I've said this for a long time, but Borrelia burgdorferi was created by Dr. Burgdorferi in a lab. He didn't know he was making something that was going to make us sick. He was doing his job, and then he would give it to the next person and the next person, and you know, it ends up in the military's hands at that point. But so we've seen spirochetes in the mummies for 5,000 years ago. So spirochetes have lived around us for a long time, but we grew up with them. And just like these viruses that aren't novel, we've grown up with them. So our immune system knows how to deal with them. Borrelia burgdorferi is a novel infection. I get caught up in my words a little bit because we know it's a bacteria outside the body, but the lab, when you look at it in a lab setting in RGCC, they laugh at me when I call it a bacteria. They say, it's a virus. It's a virus, you know, in their language, with little words and very much intensity. So it's virulent in the body. And so our immune system doesn't know how to deal with it since it's a novel bacteria with manipulated genetics.
Right.
Also, it doesn't enter through normal pathways. It enters through a bite. So
right.
It bypasses the normal immune responses, and it's almost like a vaccine approach. If we sniff the vaccine, we probably have a normal cascade. When we give cancer vaccines, we give them, you know, under the skin a little bit and let the immune system go through its normal cascade. But yeah, this is a novel virus, and Lyme is novel. That may be our last novel introduction into this society.
Well, I think, you know,
virus we'll ever create.
Did you say that's the last novel virus we'll ever create?
The last one that our society may have seen would maybe have been Borrelia burgdorferi, but it won't be the last one.
Right. Well, that's kind of why, you know, we're at a place in our society where, you know, I think in the future, war will be waged biologically because, you know, now everyone's got nuclear weapons. You can't really just blow people up anymore. So the typical ways of waging warfare aren't going to be possible if we want to have a planet. So I think, you know, there's always historically there's always been, you know, factions that fight against each other. If one world power is doing research on biological weapons, you best be sure the other ones are too. And especially with biological things, accidents happen, you know, things happen. So we have to be prepared to deal with this more than not.
Just like you want to keep your military up to date with the greatest technology. I can't even tell you how many labs are in America and over around the world that they're all playing with bugs. They're all creating something because they don't want to be the one left out when something else happens. And, you know, that's just the way it has to be. They just need to keep them in the lab and not in their body.
Right. And, you know, it's accidents happen. If you look into the history of this, there's so many cases. Go watch the movie Outbreak, or maybe don't until all this is over because it might freak you out. But you know, you're dealing with something that's invisible, and you know, very often the doctors that are working with these viruses and bacteria and pathogens in the lab end up getting sick, even if they're super careful. Willy Burgdorfer ended up getting Lyme disease because he had like a rabbit that was infected with it that was in his lab, and he was cleaning a cage and he got infected rabbit urine in his eyes, and he ended up contracting Lyme disease. So, you know, and he is the king of ticks. He'd been studying it for 40 or 50 years at that point. You know, so even if you're super careful, even if you're one of the best, accidents happen. So you got to, you know, be prepared for an accident to happen.
Absolutely.
What else did I want to talk about?
You had some, I guess since this is a Lyme light, we can talk about some Lyme disease.
Should we talk about answer some questions? I have no idea how long we've been talking. I know it's easy to get off on tangents because we always have so much to talk about. But I do have some questions for you today that some people have emailed in. So I've got my first question. Let's see here. If a person who has received an SOT for Borrelia doesn't notice any improvement after 6 months or gets worse than prior to SOT, does this suggest that Borrelia wasn't their main issue?
Very possibly. You know, there's just so much I want to spit out of my mouth right now. I'm like stuck. We try very, very, very hard to do all the right things up front. So if we're not on antifungals, and we're going to do a whole episode on Candida because it's like I'm the fungus king. It creates a lot of damage in the body. But if we don't take care of all the other pieces of the puzzle, then we may not get to the point where we need to be healed.
Right.
If a patient did really well on the molecules for 4 months and then things started to regress a little bit, then there's probably a second RNA sequence. At this point, I've seen enough tests that I can determine, like in the beginning, if someone has peaks on the IgM side and the IgG side, there's probably 2 sequences because the IgG one had to go over the IgM to get IgG. Okay. So then a new one came along and it's on the IgM side. So it's always going to sequence through. So if a patient did well on the molecules and then they have some regressions, then they probably have a second RNA sequence. If they never got better at all, it's probably not Lyme. But we need to test and make sure we're doing all the right things. I try to do it all up front, and I'm telling you, I stress out over everybody because everybody's a brand new case, everybody's individual, and I don't have many people that don't feel better through the SOT, but when it doesn't, it's not because we're not doing good work. We have to start with Borrelia burgdorferi because it is a smoking gun. It is the one that our immune system can't tackle. It's the one that suppresses our immunity. It's the one that's genetically modified. It's the one that causes all the damage, that causes the other things not to be able to get rid of, that we can't get rid of. It causes all the co's. I don't know why Epstein-Barr is a co-infection. It's not a co-infection. You know, Bartonella and Babesia are co-infections, but everybody kind of classifies all the viruses and even mycoplasmas as a co-infection. Not really. But, you know, we can umbrella them as a co-infection. So the reason you can't get over the other co-infections is because, yes, ma'am, is because that we got to get rid of Borrelia. So if we get rid of Borrelia and I see a patient again and I can move it off the table because you've had an SOT, the labs look better, like you're improving, then we start tackling all the other things. I guess that's the easy point to the question.
So to clarify, because, you know, people ask this very often, you know, they will get the SOT and, you know, maybe feel a little bit better, maybe not, maybe they feel worse. And then they freak out that, oh my God, it wasn't Lyme. But to clarify, even if you have another infection that is causing you to have severe symptoms, you might have really bad EBV, but you're probably, if you have a Lyme also, even if you're not having Lyme symptoms, you're not going to clear the EBV, or it's going to be almost impossible, much, much harder to get rid of any other infection if you also have Lyme, because the Lyme is preventing the immune system from doing its job.
Correct. We would be chasing rabbits by beating up co-infections if Borrelia is still there, because we can knock them down but Borrelia is messing up your immune system, so they're going to pop back up eventually. We're just going to be chasing rabbits around. The foundations that I've set forth work. I'm pretty sure we have about a 95% cure rate, or at least, functional rate, where somebody can say, I feel a lot better. Maybe some things are left. We all have things that
Right.
are left, and you start to get some normal colds and some normal sicknesses that you may not have had before, because now your immune system is working. Now, I say congratulations, welcome to normal immune health.
Welcome. That's good to talk about, because I think everyone's generally very used to, they see a doctor for one specific thing, they go in and they see, well, these are my symptoms. The doctor says, okay, well, this is what I'm going to give you for those symptoms. And then you leave and you never come back. And it's just, you take things and you either have the symptoms or you don't. And I think a lot of people are under the impression maybe that they're going to come to you the one time, they're going to get the SOT, they're going to leave, and it's all going to be just roses from there. And what I love so much about you is that you do treat everybody very individually. Every single person is different. Everyone's got different issues, whether it's co-infections or other infections, candida, lifestyle, mold, it goes on and on and on. So you can't really look at one person's experience and compare it to yours. And it's much more important that people do follow up with you. They do come, either phone or in-person appointments with you, to really figure out what is causing their problem, because everyone is different.
Yes. And sometimes we get Borrelia off the plate, off the table, but then we're just left with the damage that Borrelia caused.
Right.
So therefore I have to go and have to understand that, and we together have to make a decision to move along into the healing phases. Of course, we are moving into a new field of stem cells where we're going to be doing exosome therapies, which I'll just leave it at that, but know that it's very, very good and inexpensive. So we're going to have some very good ways to fix damage. Yes, I'll let you know.
Cool. Well, that was, let's answer another question. I'm getting off track here. I think we should do an episode of just talking about healing post-Lyme. So after our Candida one, we'll do that one. So stay tuned, everybody. Okay, so next question is, can you explain or give an example of how it can be determined whether someone has reactivated viruses such as EBV, CMV, or other herpetic viruses, rather than just having high titers of antibodies for the viruses?
Right. So refer to the graph, that's on the Facebook site. Every virus, bacteria that goes in our body, even coronavirus, it goes in us, our immune system recognizes it, we hit our IgM peak of our body fighting it. And then once we're starting to get over, we slide down over into the IgG side, which may still be active or it may be past. How do we know the difference? We know the difference by looking at how high the antibody is on that virus or mycoplasma. If the IgG is on, but it's below a certain index, then we feel comfortable that it's just a past memory and it's not affecting you. If the IgG is on and it's at a high antibody level, and through different companies, they have different reference ranges. So we have to kind of be able to understand that through the company I use, that if the index is above, if it's 3 to 6, it's usually mildly reactive. If it's 6 and above, then it's highly reactive. But just remember too that viruses will always hold their antibody for the rest of your life. If you've ever had a virus, we'll always be able to see it there. Always. Bacteria like strep, staph, they come and go. And co-infections, Babesia, Bartonella, they come and go. They don't hold like Lyme does. So people know that your co-infection isn't always going to show. If it showed last year or the year before and you come to me and it's not there anymore, I try to redo what you had same test to same test, so I can make sure I'm doing accurate work. But it's going to hold, and we're looking at the peak of the antibody level, and
Okay.
then
So
if it's
that's,
still there, then antibody out.
is that your, so is that like the threshold line on your chart there? Where it's like, if it's above that line, it's active?
Yeah, so take off the bands. So forget about the bands. Take them all away.
Okay.
So this graph actually is the same response for antivirus. So if you're past that threshold point, you have a past reactivated virus.
Okay. But it still is going through. All right. I'm understanding. So does that mean that, if people are getting tested, you're going to have novel coronavirus antibodies forever?
I'm not sure about this one.
Well, I guess because it could be
That's,
like flu where you get antibodies only for several months, right?
I think it's just going to be for a period of time because you can catch it again. If you can catch it again, then the antibodies come on and then completely off. Like West Nile virus. That is a virus that will come on IgM, on IgG, and then it comes off. And because you can catch it again.
Okay.
That's the easy way to put it.
Okay. I think that's my biggest question still with the coronavirus is what type of virus is it? Are we going to hold antibodies forever or only for a period of time?
So we have the coronavirus antibody test now as of yesterday.
Cool.
You can actually test people to see if they've had it in the past, and those people need to be out in public and out in society to spread some antibodies for the herd immunity that we're needing so badly with this thing.
Right. I have seen there was a study, there was a guy that was actively shedding the virus for over 60 days, like 60 something days. And he had reached this like weird point in his immune system where he was just like kind of fighting it, but it was still shedding. So he just had a cold for 2 months and they tested him and he was still shedding the virus. And the way that they cured him was by giving him plasma of someone who had gotten over it. So then he got the antibodies and was fine.
Sure. Perfect. Excellent.
So,
Excellent.
All right, next question. Thank you for answering that one. All right, is Bartonella SOT being offered at the clinic?
Yes, it is, Maddie.
Woohoo!
Yes. I think we've given a couple, but we have quite a few of them outstanding for patients that still test positive from the past and they're still hanging around. Of course, we do the Babesia one too. I've only had to do a couple of those because Babesia is not too hard to get rid of. But there's 3 different Bartonellas, the Henseley, and there's 2 others. I don't remember them offhand, but yes, we're offering it and it should work very well, but we're always going to want to make sure that Borrelia is taken care of first.
Right. I think people ask me all the time if I had COs, and I've had lots. But I tested for Ehrlichia and Bartonella early on, and then never tested for it again after doing lots of antibiotics. So I do think the antibiotics got those 2,
Sure.
just not the Lyme.
Sure. Excellent.
So that might have been my last question for today. Right. Oh, one more question. Is EBV sexually transmitted? It's sexually transmittable.
No, it's not. But if you kiss somebody, you can transmit it. It's aerosoled, just like the flu and coronavirus. So it's aerosoled. The kissing disease that you get when you're young doesn't have to be from kissing. It can be from the kid who sneezed in the hallway and everybody gets sick, or you're drinking after somebody. Just little parts of DNA that can fit into a fragment of a water vapor. That's why we have been wearing some masks around here, really not to protect our patients so much, to protect our patients, not so much us, because we've had high exposure seeing patients, but we're wearing a mask just so we don't spew viruses on people.
What do you think about that? Do you think that mask wearing is going to become more common in this country now, kind of like it is in Asian countries?
I sure hope not. I mean, it's like using antibacterial hand wash all the time. We actually need those bacteria in our body. We have around 10 trillion cells. Yeah, 6 trillion cells in the human body. And we have 60 trillion bacterias, and we have like 350 trillion parts and pieces of fragments of viruses in the body. So these are things we need to use to create our own immune response, and we're healthier to fight cancers and things later in life when we've had good immune responses to viruses.
Right. Hi guys. So unfortunately, my computer freaked out and crashed at the end of that there. But we were pretty much done with all the important stuff anyway. We're just getting off on another tangent. So we're going to go ahead and end the podcast there for now. But we're going to pick up on the next episode. We're going to do an episode just about Candida to answer all your Candida questions. So if you do have questions about Candida specifically, please send them to the email limelightpod@gmail.com. And then we're also going to do an episode about Lyme healing and what to do, different options and things that you can do to heal after your Lyme SOT. So we've got lots of great stuff coming up. Again, please email me. You can send me a message on Instagram or on the Facebook group, or email the Limelight Pod email address, and we will answer your questions on an upcoming show. So thank you guys so much for tuning in. Sorry for the little technical difficulties there, but I really hope you enjoyed this episode, and I hope you guys are staying safe and having a great day. Bye.